This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Well, sitting across from me, as often is the case, is Russ McDaid. He's the president and CEO of the Pennsylvania Healthcare Association. They do a lot of work on behalf of seniors, those seniors who are thinking about, though I got that right, Russ, thinking about or actually in long-term care situations. Am I right about that?
Right on both counts, Terry.
Okay. Let's start with something perfunctory, I know. We're going to get in a little bit later to the future of long-term care, skilled, the whole business of what you all do. But you're impacted by the state budget, correct?
Yes, we are.
So what's the situation with long-term care in the state budget, and then what do you use it for? Let's start with that.
Yeah, well, and first of all, thanks for having me again. As you know, the governor's budget was released in early February, and unfortunately, again, we feel like it missed the mark in providing adequate funding for our seniors who require 24/7 round-the-clock care in skilled nursing and rehab centers.
Right. Let me say something. I might have mentioned, we talked about this a bit before, but is there any family you can think of that somewhere along the line, usually the kids, but other relatives are saying, what are we going to do about grandmother and grandfather? And they need care now. And there's virtually, in many cases, little planning about that. And that's where you come in.
Oh, and you're absolutely right. I mean, when we talk about it in the context of the state budget, when you and I go to the hospital or to a doctor's office, we have a private insurance card, and that pays for our care. Here in Pennsylvania and a lot of other states, almost 2/3 of the care provided in our nursing facilities is paid for by the state and federal government under the Medicaid program.
That's correct.
And it's that Medicaid funding that's falling well short of meeting the needs of our seniors residing in skilled nursing and rehab centers. That's really at the center of the issue. And families don't take the time to know when Medicaid kicks in, when Medicare kicks in, and who pays for what when.
No. And here's the difference. The discussions that I have with my friends are, well, remember, I can't give them, I love my grandmother, but I can't do what they need. They need 24/7 care.
Yeah, you use the word need, Terry, and that's the right word. It's about need. Now, our facilities today aren't caring for people who don't need to be there. And that is the challenge we face. We all want what's best for our loved ones. And in many instances, what's best for our loved ones is that round-the-clock skilled care that only our skilled nursing and rehab centers can provide. And we've got to find a way to do better for them as this budget process moves forward.
And the other thing you point out is that a fair number of people will go in for a short period of time and then go back once their condition, their medical condition is, reduced, minimized, or even eliminated, right?
Yeah, that's right. I mean, the nursing home of several decades ago no longer exists. In the 1990s, people used to go into nursing homes and live there for years. And in the 2000s, it went to months. And now we often find, here as we sit here talking in 2017, folks needing only weeks of care. But it's pretty heavily intensive and costly care to get them back home when they can go home.
Well, then, let's go to this sort of an important second question, which is, how does the budget affect long-term care in this state?
Well, we as Pennsylvania taxpayers, we look for a lot of things from government. We want government to provide us with safe communities, want us to provide us with safe bridges and roads when we travel where we're headed, a high-quality K-12 education, and we also want the government to provide us with high-quality care for our seniors. And as I noted, the state pays for roughly 2/3 of the nursing home care in the Commonwealth, and so that funding comes directly out of the budget process that started with the governor's budget address, ends when we have an enacted budget, and that's why it's so essential that everybody think through the commitment needed in the budget to our seniors.
Yeah, and the budget would cut access. Ultimately, isn't that your point? When it all comes down, it's about access, and if the budget's cut, then fewer people have access.
That's absolutely correct. I mean, in 4 out of the last 6 years, I'll give you some context. 4 out of the last 6 years, there's been no funding increase for our skilled nursing and rehab centers and Medicaid under the budget. If the governor's proposed budget were to go through as offered, it would be the 5th year out of the last 7 that we haven't seen an increase. We've seen a number of high-profile sales in the Commonwealth recently. There's a lot of change in this landscape, and you know, each and every day, our members are challenged to make the investments that they want to make in their staff and their residents because of those funding difficulties.
And I'm not even going to get into the issue of the changes to the Affordable Care Act and what might happen to Medicaid in this state, where something like 700,000 people are on Medicaid, right? And I'll skip that. We'll get you on and do that at another time. As we talked about, there's a lot of resistance, as you know. We talked about that. People don't really want, but when they go, what do they want? When you finally get in a nursing home, you hear it all the time.
That's absolutely right. You want high quality care once you get there. You know, I don't want to need open heart surgery, but if I ever need it, I want there to be a high-quality hospital available.
Yep.
We don't want our loved ones to have to go into a skilled nursing facility. When they do, we want to make sure that the right one's there to meet their needs and that they have a highly skilled and trained staff ready for that.
And you did a poll. You have a poll that your organization conducted, and were there findings there that our viewers shouldn't be aware of?
Yeah, actually, I mean, we've been out asking Pennsylvanians what they think about these issues, and in December, a private corporation did a poll of 800 registered Pennsylvania voters and asked them a number of questions around long-term care, and almost 90% of the individuals polled said that cuts to Medicaid funding for nursing facilities was unacceptable to them. We asked them where those things ought to be prioritized, and funding for our seniors who need that 24/7 round-the-clock care ranked ahead of a laundry list of other things that state government does, including, frankly, some of those that I named off earlier, you know, public safety, roads, education, highlighting, you know, you never like to pit one against the other. The fact is, those folks who were polled clearly understood that with an aging population and with a sicker population, we need to make strong investments in our facilities. 2 million of the 12 million of us, I'm rounding off some numbers here, you know, that reach, 65 have, you know, we have an elderly population, and the longer we live, and we are living much longer, folks are living into their 80s and 90s now, that ratchets up. Finish the thought. Ratchets up the need. That's right. There's a stat out there that 3/4 of us will need some type of long-term care in our lifetime, and once you make it to 80, the likelihood that that long-term care will be some sort of a 24/7 round-the-clock stay in a facility increases significantly. So you're right, Terry. The more, you know, we're living longer than ever. We're healthier longer than ever. You know, we can be very active through our 60s, 70s, and 80s. However, we're going to see more and more Pennsylvanians in their late 80s, 90s, even over 100, and we need to invest in care and services for them.
All right, we're going to go to a break. When we come back, I want to ask you another question dealing with misconceptions about nursing care. I think a lot of people are just genuinely, or generally, I should say, unfamiliar until they go and get the orientations and find out what actually happens. And there are some misconceptions about skilled nursing. Actually, I think it's more that people don't know a lot about it because they don't have daily contact.
The biggest thing that I hear is that there are a number of people in nursing facilities who could be cared for elsewhere, that they should be out in the community in their homes instead of in the facility. I got to tell you, I tour our facilities regularly, Terry, and I don't see people who don't need round-the-clock care. And as I noted earlier, a lot of people are able to go home, but not without that high-intensity, high-cost care in a facility on the front end.
Yeah, so they have to make a whole variety of changes. Nursing homes, long-term, are always going through constant change.
That's
and that requires this, green.
It requires cash. It also requires a skilled workforce. I mean, when we look at one of our largest challenges, I mean, our largest challenges are two. You said it's about cash, and I've mentioned the budget shortfall and the fact that we need more help from the state budget for our skilled centers. People are the other one.